The following segment is sponsored by Inovia Vein Specialty Centers.
Welcome back to AM Northwest. How do you know when the pain in your leg is something more serious? Here to share more about DVT during DVT Awareness Month, we welcome back from Inovia Vein Specialty Centers, Dr. Jason Gilster. Good to have you back again, Doc.
Good morning.
What is DVT?
It stands for deep venous thrombosis, which is a blood clot that forms in the veins.
And how would someone recognize that? Like, what are the symptoms? How would you even know you have it?
Yeah, typically it presents with pain and swelling in the calf. And then sometimes it can be one leg and sometimes it's both legs. It just depends on the person.
So in the calf?
Yeah,
and
typically.
Typically. Can it be other places though in the leg?
Sometimes it can be swelling of the whole leg. Just kind of depends on the size of the clot, but
Right.
it can be a whole leg symptom as well.
Why is DVT awareness so important?
Well, we want people to be aware of the condition because it can be a life-threatening condition that comes on rather suddenly for some people. And so we want you to make sure you know what it is and to seek medical care.
If it goes undiagnosed, will that cause a problem? I mean, that's got to be...
Absolutely.
Yeah.
So it can be a life-threatening condition or cause some long-term swelling and pain. So we do want people to, if they suspect it, to reach out to their medical provider or go to an emergency room.
So you said the swelling and the pain, those are most typical signs?
Yeah.
Okay. And then what should someone do if they suspect they have DVT?
Definitely reach out to their medical provider, or if they can't get a hold of them or don't have one, go to the emergency room. It's typically diagnosed with a physical exam and the use of what's called an ultrasound.
Okay. We were talking about symptoms. Let's take a look at a chart that kind of shows some of the symptoms here. Talk to me about, you've got pain in the calf, swelling in the lower leg, redness as well?
Sometimes it can cause sort of an inflammatory situation where you get a little redness.
And then symptoms are usually in just one leg?
Yeah, typically the clot, it'll be the leg that the clot's in.
You treat this at Inovia.
Mm-hmm.
Tell me about the other vein conditions that you also treat.
Yeah, the other condition is referred to as venous insufficiency, where the clots, the valves in the vein will fail, and people will get swelling, maybe bulging varicose veins, and then get some darkening of the skin and even wounds.
And you treat those as well?
We treat that condition in the office with a minimally invasive procedure.
That's fantastic. How many sessions before you're able to see relief or feel relief from that? Well,
it depends on the patient, but typically there's a few sessions that are used to treat the veins, but they're usually quick office-based procedures.
When it comes to who gets DVT, is there a certain person? Is there someone who travels a lot by plane? Is there someone who sits a lot?
It can be really everything. The thing that we really watch out for is after surgery, a lot of people will develop clots. So that's a really high risk sort of population. But any of us are at risk for it at some point. So that's what makes it a little scary.
Right. Well, we need to be aware of the symptoms. Yeah. Okay. We want to tell everyone, if you would like to find out more about Inovia Vein Center, we're going to put all the information for you on treatments and all of that on our website at KATU.com/AMNW. Doctor, thank you very much.
Thank you.
Appreciate it.